So we're continuing our series teaching a little bit of muscle work that we can be doing at home. So as a preface that I've said this in some of the other videos, this is stuff that you can add to the tool bag when you're at home and it's a Saturday night and you're sore and stiff. These are some things that you can do at home if you've got someone that can do some of this work with you. So we really recommend for these kinds of videos, have a partner. But this is free. It's free muscle work. It's a free way to stretch. And anything with healthcare that's free, if you can add to the skill set, it's always going to be a benefit for you. So what we're going to be teaching today is called an iliocostal lift. This is one of the ones that we teach for helping work with low back discomfort. So if you are someone that is suffering from that, this is something that can be very, very helpful. We're going to be doing that work right now. Kelsey, I'm going to have lay face down. Now when we do this, it's a little bit of a trick finding a proper surface to do this on. And what I mean by that is, if the surface is too soft, we typically don't get a lot of the work done. So a couch, the floor can work, though sometimes the angles can be a little bit tough. A bed can work too, but again, if it's too soft, it's going to give a little bit too much. It's a harder way to work it. So how we're going to be doing this is first, let's kind of get our idea figured out where our natural landmarks are. Our sacrum is here, which is the big block at the base of the spine. We have our glute muscles, and then we have the low back, and this is a couple of different kinds of tissue. Lumbar paraspinals are in here. We have quadratus lumborum. This is the area that we're going to focus. So how we do this maneuver, what we're going to do, we're going to first take our right hand, and anytime that we're doing this work, if I'm standing on her left side, I'm actually doing the work on her right side. So you're always working on the opposite side that you're standing on. So we start by reaching underneath her hip and grabbing onto her hip bone. I'm actually grabbing the hip bone right here through this area so I get a hook on it. And what that's going to let me do, it's going to let me pull up on the hip, and then I'm going to be using a contact here with my left hand to press down at the same time. This elongates the spine, it takes pressure off the disc space, and then it also winds up stretching out the muscles a little bit too. So the key with this is knowing where to put this hand too. This one's very simple, this one not quite as much. Kelsey, is it okay if I bring up your shirt a little bit?
Absolutely.
Perfect. So I'm going to teach you guys where this contact needs to be. So if we run our hand right down here down the middle of the spine, you're going to feel these little bumps. These are what's called spinous processes. These are bones off the back of the spine, and they're a location for muscle attachment. We do not want to put pressure on these areas because it will be miserable for the person receiving the work. How we're going to make this hand placement, we're going to use our palm. And what we're going to do is, again, I'm sitting on the left side of the table, so I'm going to take my palm, I'm going to place it just to the right of those spinous processes. I'm going to press into the tissues and push away from myself. That takes up what we call tissue slack. It stretches the tissue a little bit, it takes away that little bit of give, which makes a better stretch as we pull through. So, I've got a contact point here with my left hand. I'm going to take my right hand, reach underneath her hip. I'm going to pull and press down at the same time. So what you're seeing here, right arm pulls up, left arm kind of just remains straight, and we're stretching out that low back. Each movement, I move a little bit more towards her head. So at this point here, I'll just bring down the shirt. There we go. And you can see that we get more and more stretch the higher we go. Be mindful though. Once we get about 2 hand lengths, 2 hand widths, should I say, up from the base of the spine, then we start to get into some of the cartilaginous ribs. We gotta be careful with that area that we don't put too much pressure on it. So typically about 2 hand widths up from the low back, this is as far as we wanna go with the work. But as you can see, we just hook, pull. Kelsey, how's that feel?
Wonderful.
And what this is, it's like almost like a nice light form of traction. So for any of you that are suffering from low back pain, when you sit for a while, your low back gets stiff, or if you're standing, it gets stiff, this is a nice simple stretch that you can do, and it feels so good. So we're going to continue our series with working through the glutes. We'll catch you in the next video for that.